Hey, it is Monday and we are almost done with the entire book. So that's exciting because most of the book work is knowledge base that you have to have in order to pass the written test. And then which is easy because all of you all are super smart, and you're able to think critically as long as you don't think into it too much. Okay, and then the other part is the skills. So with the skills, chapter 6 and chapter 7 are both skills chapters. So the review of the slides today, I'm going to be reviewing about half of the slides because the skills are the other parts of the slides. And that's where we do most of our hands-on. Of course, we won't be doing hands-on this week, but we will pick back up with it next week. So let's get started. So chapter 6 is, so I am playing with this new technology. And it's probably not that new, but I usually do my recordings on Zoom. So that way I'll know that it is all done. I know about Zoom. Now I'm doing a recording on the PowerPoint, which is a little bit different for me because Microsoft PowerPoint usually is just PowerPoint, but now they have this recording feature, which might not be new for you guys, but it's new for me. So if I look kind of glitchy, I am trying something new. All right, so um, what is hygiene? Of course, we know what hygiene is. It's keeping our bodies clean, and if we are clean, then we have less germs. And then grooming is everything else. So grooming is doing our hair, doing our makeup. Grooming for our residents could be doing their hair, doing their makeup, making sure their nails are clean up under. Doing their foot care more than just bathing them and changing their diaper, their brief, and making sure they're clean and dry. Okay. So in this chapter for us, what can nursing assistants do? So you're helping with elimination needs, you're doing perineal care, which is cleaning below the waist. You're helping to wash their face, wash their hands. You're helping them to shave, doing mouth care, all of that. Okay. Um, PM care, pretty much the same thing. Um, putting on different clothes. You would do that in the mornings also. You give them a back rub when they get their baths. Okay. And then what do we do? How are we assisting them with their personal care? So, of course, we always want them to be as independent as they can. We're going to be as professional as we are always. We are going to use that indirect care. So we are providing privacy for them, respecting their rights and their needs, and everyone's needs are a little bit different. We are leaving the clients or the residence room clean, straightening up anything, taking any trash out that we can, leaving the bed at its lowest position, giving them the call lights, and making sure that they don't need anything else. So everything that you verbalize when you are walking into a room, when we do our skills, and everything that you verbalize and do when you walk out of the room. That's how we are treating our patients. Okay, so how can we promote the residents' dignity, respect, and privacy? Of course, we're knocking on a door, trying to see if we can come in. Because one thing that you don't want to do if you are just have your hands full of linen and you zoom right in, what might they be doing? They might be doing something that I can't say out loud because I have little ones, or they might be doing something else. One starts with the S and one starts with the M. Okay. Um, so we don't want to interrupt them doing those private things. If they are on the phone, um, if they're getting dressed and they can get dressed by themselves, if they're in the bathrooms and you know that they don't need any assistance, and when we keep them covered as much as possible. Okay, so pretty much everything that we're practicing, y'all are already doing. So good job. All right. So, what are we observing while this is happening, while we are giving them some personal care? So, we are observing what their skin looks like. We're observing any changes. Do they have any kind of flexibility issues, mobility issues? Are they in pain? Do they have any complaints? Are they acting a little bit different? Like their mental emotional status is different. Um, those are things that you will know once you get to know your resident in the nursing home. In the hospital, you are going to have to be a little bit quicker, and things change a little bit faster in the hospital too. So you go in the morning and they're happy, they're talking to you, and then you go back at lunchtime and something is a little bit off. You will notice that too. The hospital is a little bit more fast paced than a nursing home, but once you get those skills down pat, you will know what to assess for and what to look for. Okay. All right, so let's talk about pressure injuries in skin care. So we always have been talking about pressure points and skin ulcers. So pressure points are where the body is bearing weight on different areas in the body. So if they're laying flat on the bed, there are pressure points on the back that we'll look at a picture, and the bony areas that are the bone is closer to the skin and then it's closer to the back of the bed, then those are those pressure points that might break down sooner than the other parts of the skin. If that happens, then they're going to have pressure injuries. Pressure injuries are also called pressure ulcers, pressure sores. You will hear a lot of bed sores or decubitus ulcers. Those are all the same. That means that it is opening in the skin because of some kind of pressure that was on them, whether they're laying on their back all the time, laying on their sides all the time, if they're in a wheelchair all the time, too. If you're in a wheelchair all the time, that means your back and your butt, um, your backbone, and your legs. All of that is a pressure point. So you might see some breakdown on both of their butt cheeks. Okay, you might see some breakdown right in the middle of their like tailbone. Those are things that even though they're immobile, but they're in a wheelchair all the time. If they're in a wheelchair for 8 hours out of the day, then we might want to start taking wheelchair breaks. Okay. Um, shearing is where it's kind of like friction. So that's why we don't, if we're like changing the top sheet or changing the bed sheets up under them, we don't just pull from up under them because you're creating friction. And that friction means that you are pulling the skin. And as we know, there is skin thinning because they're a little bit older. And that means that you might break their skin open. They're going to have a pressure ulcer, and then there will have an increased risk of infection. So let's not do that. Draw sheet, we'll look out, make sure, remind me when we start to do our skills next week to show you what a draw sheet is. For those that have worked in hospital or in a nursing home right now, you already know what a draw sheet is, but I love draw sheets. Draw sheets will help you to pull up a person so quick, not really by yourself unless you absolutely have to, but more so with a partner on the other side. It could be a 300 or 400 pound person. It could be you and two other people. Y'all are gonna pull that person up with no using good body mechanics and no issues at all. Okay. All right. So foot drop. We kind of talked about foot drop already. I think it was in the musculoskeletal video. So this is your foot. Your foot looks like this. These are my toes of my foot right here. Okay. And this is just normal. But because I am bed bound and my foot starts to have some atrophy in them. Atrophy is the weakening of the muscles, and because I'm not using it anymore, then the foot starts to kind of go like this, and then all of a sudden your your foot just looks like this. Okay. And if we try to get that person up, stand them up, try to start to walk them again, you really can't because their whole foot has slumped over like that. So that is what foot drop looks like. There is a picture of foot drop in your book. Um, orthotic devices, those are like almost like splits or um, different braces that you can put on to help bring that back into place. So if it's foot drop, we'll put a brace on to make sure that the foot gets molded back into this area. It's not really a cast. It's something that we can take off in at nighttime. Okay. So they will wear it for a couple of hours during the day. They'll take a break, wear it again for a couple of hours, take a break, and then take it off overnight. And that's something that is ordered by the doctor, and it has to be a written prescription for it for them to get measured and everything. So we can't just go by it. All right. So the prevention is the key to skin health. Once a pressure ulcer forms, it can get bigger and deeper and become infected. Pressure injuries are painful and difficult to heal. And why is it so difficult to heal? It's because they're a little bit older. They might have other disease processes going on. Diabetes, we already know, if they get something, even a simple cut, it's going to be harder for them to heal from that. Okay. So this next slide are the pressure ulcer dangers. So here he's laying on his side. Okay, that's good. We have him on his side, right? It's relieving the pressure on the back. But look at the different places that we have the pressure. So on his face, on his ear, and real talk, you will see if we had him on his face for like the whole day or maybe 2 or 3 days, you will see redness on his cheek, redness on his ear. And then if it was a neglectful situation, then you would see holes there. And I have seen it. It's not pretty. Shoulder, hip on the other side. That's your hip bone on the other side. Knee here, the knee up under that's hitting the bed. Ankles on the other side, closer, even on this side. Okay. Okay, so I wasn't able to go back to that slide, but look in your book because you have those in your book. If they are in the laying on their stomach, then what do you think is going to be those pressure points? So it's going to be their chest, it's going to be their stomach, it's going to be their knees, the tops of their feet. And if they are laying on their back, we already talked about the pressure points on the back. Okay, so you do have those pictures in your book or in your workbook. All right, so observing the skin, these are things that you would automatically know something is not really right. Okay, so if you see pale, white, red, and gray or purple skin, and that looks a little bit abnormal than the rest of the skin area, then there's something wrong. Blisters or bruises, of course. Change in temperature. If you feel right here and it's warm, but you feel here and all over the rest of their body, or if it's cold and the rest of your body is warm, those could be signs for decreased circulation or blood clots. Okay. Um, Dry, cracking, flaking skin. That is either they're super dehydrated or they might have another disease process going on. Um, Itching, redness, rash, swelling, all of that. And even if they have a ulcer, say my ulcer is right here, then you want to keep note of it to make sure that it looks the same. It's not getting bigger instead of smaller. Yes, the nurses will do that, but you are also a patient advocate, so you can just take note of it mentally to say, this is draining now. It wasn't draining yesterday. Let me make sure that the nurse knows what's going on and has noticed it. Okay. Okay. So, what are you going to do? What are your guidelines as a nursing assistant? Okay, so you're going to report the changes of skin. You're going to provide regular skin care, reposition often. That is at least 2 hours, every 2 hours, okay? Frequent skin checks for those that are incontinent. So if they don't know, if they can't eliminate by themselves, they can't pee or poop by themselves, and they either have a diaper on or brief, they have, they're using a urinal, they're using a bedpan, or they have a catheter, okay? And then report anything else that you find. Um, Here, you're going to do skin massages, but don't massage over the white, red, or purple areas. That is maybe there is some skin injury going on. Maybe there is a pressure ulcer that is happening there. Um, so don't you're going to might make it worse than better. If it is a blood clot and you start massaging, a blood clot might start to move. So you really don't want that to happen, because if the blood clot goes to the brain, or if really the blood clot is going to go to the heart, then you're going to have a heart attack that has happened. Um, and overweight residents, pay attention to under the skin folds, because that's where a lot of the breakdown happens. That is also where a lot of the skin rashes happen. You can pull up their breasts, you'll see a cut up under there. You might see something that's white and pasty, like a yeast infection. Those are things that you can pay attention to, and you will see them if they're overweight. Also, their thighs, their legs, you can pull up their stomach, you might see some cuts there. Those are things that you can keep dry and clean. Make sure that you don't have any extra things. Sometimes they might have crumbs in there. I know, right? If you do put like some special cream or some lotion on it, make sure you rub it in and it just doesn't stay there. But those are things that you do ask your nurse about before you do it. Okay, encourage residents to eat a well-balanced meal, drink plenty of fluids. That is for everyone. We always want to eat a well-balanced meal because food is health also. All right, and then follow the care plans. Okay, bedbound residents are high risk for pressure ulcers. We already talked about that. The number one thing that we did not really say is to keep the sheets wrinkle and crumb free. Wrinkle free, because you don't want that wrinkle to be up under that skin, up under that leg that's already a pressure point anyway. And then that crease is just going to be an aid in making it be an issue, making it be bigger. Crumbs, same thing. This little crumb makes that pressure ulcer bigger. And you're like, that's not even the shape of anything. What was that? It was a crumb. I don't know what it was. It was like cornbread or the last thing that they ate. um, we did a laying the person over to the side and put the pillows there. We already did that. What did that relieve? That relieved some pressure. So keep on doing that, okay? All Right. Reposition people in wheelchairs so they can change their positions too. What are some devices that we can use? Backrests, bed cradles, draw sheets, footboards, hand rolls. These are just things that help to relieve pressure and also position a person in such a way where they don't have that much pressure in one area. That is good. Partial bed bath, we already did that. That's where we washed their face, their chest, their arms. We didn't go below the waist. We washed their back, and then we gave a back rub. Okay. The next thing that we will do is the perineum, and that is for women. We're going to do a incontinent care for somebody that has a Foley, incontinent care for somebody that's, or perineal care for somebody that is just incontinent, they're just wearing a brief. And then we'll talk about, those are both for women. And then for men, we'll talk about washing an uncircumcised and washing a circumcised. Okay? Okay. So you'll find that in the nursing home, there are people that use the nursing home facility products, like the facility soaps and the facility lotions. And we all know those don't smell good, they might not work as good, but those are hospital grade or medical grade products. You'll also find patients or residents that have brought their own stuff in. And when you're bathing them, you're like, what is this again? Because I want to buy some for my house. They smell so good. You can use them. If you're in a nursing home, you can use them because this is their home and they bought it for them. They're used to it. It's not like that you're coming in, bringing them something, and they're going to break out from it and it's going to be your fault. That's not it. If it is, and this is reality, they bring their stuff in, they're going to use it. If you ever have this on your test, always use facility approved products. Okay, so if you have this for your state test, always use facility approved products, but reality is whatever they have, you can use. Okay, all